Hey, today we're going to be talking about RSV, which is respiratory syncytial virus. It is typically transmitted by droplet and contact properties. So RSV typically will affect negatively children, specifically infants under the age of 1. However, it can also affect adults. Typically in adults, unless they have an underlying condition, they will just have the common cold. It typically starts in your upper respiratory tract, and it will move down over the course of 1 to 3 days, and can potentially cause a lower respiratory infection. So the symptoms of RSV are a runny nose, a decreased appetite, coughing, sneezing, a fever, and wheezing. In infants under a year old, the main symptoms are irritability, decreased activity, and breathing difficulties. RSV can lead to more severe infections such as pneumonia and bronchiolitis, and that's the lower respiratory infections. And the most common cause of lower respiratory infections such as pneumonia and bronchiolitis, that's the number one cause in children under 12 months is RSV. So things that put children at high risk are premature infants, young children with congenital heart defects or chronic lung diseases such as asthma or cystic fibrosis, and children with a weakened immune system. Things that will make an adult high risk are a compromised immune system, underlying heart conditions, and underlying lung conditions. 3 questions that would be important to ask during a workup would be, 1, if it's a child, does the child go to daycare, or have they been exposed to anyone that is sick? This is important because if a child goes to daycare, they're potentially exposed to a ton of things every time they go to daycare, and that would definitely lead, if there was an outbreak or something like that in the daycare, that would be a simple way to figure out exactly what's going on. The second question will be, how high have the fevers gotten? That's important to make sure that, the parents are keeping track of the fevers and understanding, how important it is to treat those fevers, and also to ensure that they're not getting too high. And then the third question would be, for adults and children, have they had any trouble breathing? That's really when RSV becomes dangerous, when respiratory distress starts taking place. So for RSV, you're going to test with an RT-PCR nasal swab, and it's usually a pretty quick swab. They can do it in like 15 to 30 minutes, depending on where you're at. So for your assessment, the 3 systems that I think are the most important to assess would be your constitutional, because you want to assess for fevers and skin color. And then the second is head, ears, eyes, nose, and throat. And you want to assess for coughs and runny noses, and things like that. And then in your respiratory system, you definitely want to assess those lung sounds, make sure that those lung sounds sound good, and check for cough, shortness of breath, and wheezing. You definitely want to assess for those lung sounds, because when that moves down into your lungs and you get the bronchiolitis and the pneumonia, that's when RSV becomes dangerous. So that's going to be your main assessment. Physical component is assessing the respiratory system. You also want to check in children, make sure that they're not retracting when they breathe. And then adults, if they are having negative side effects from this, you want to ensure that they're not sitting in a tripoding position and having trouble when they breathe. Assessing the cough and the runny nose, while those are not fun side effects, they're typically just symptoms of a common cold or RSV, which aren't really dangerous but can be discomforting to the patient. And then, of course, the fevers, because you want to make sure that those fevers are being treated. So for treatment, unfortunately, considering this is a virus, you really have to just manage your fever and the pain with Tylenol and ibuprofen. You want to ensure that you push fluids, because you do not want your patients to get dehydrated. You can potentially prescribe a cold medication such as Mucinex, but that's going to be case-by-case dependent on the patient. And then you can also prescribe a nasal saline spray for congestion and runny nose. And then potentially a bronchodilator, but that will also be patient dependent. For teaching, you want them to know that RSV is a viral infection, so antibiotics are not necessary. Symptomatic care is the only treatment, and you want to treat fevers with Tylenol and ibuprofen. Monitor for signs of dehydration, dry mouth, a decrease in wet diapers. Monitor for difficulty breathing. Adults with RSV should avoid young children when possible. Cover coughs and sneezes, and wash your hands frequently. Thank you.